I think that many of you listening today are aware that a significant amount of people, 3.5 billion, are suffering from oral illnesses. And on a positive note, most of these oral diseases are largely preventable, simply through effective daily self-care and appropriate professional care. So how is this related to sustainability? Health and disease prevention is key towards sustainable development. And overall health is actually seen as a reliable measure of how well sustainable development is progressing in general. And a healthy population can actually also contribute to a healthier environment when, for example, fewer resources are used in treatments of those diseases. So imagine the power we have as a global dental community and the ripple effects that we create by raising awareness together about prevention, the connection between oral health and general health, while supporting and educating about the importance of simply having a daily oral care routine and ideally professional guidance along the way. Warm welcome to you all. My name is Julia Lönnegren and I am the Sustainability Manager at TP. In the agenda of today's webinar, we will take a different perspective. We usually in our webinars are more focused on clinical dentistry, and we think it is also important to widen the scope and lift the importance of sustainability and the connection to oral health. And if you have any questions, I encourage you to take a photo at the last slide of this presentation. I have shared my email address there, and you can share any questions that you might have, and we will gladly answer any of your questions. And today, we will take a helicopter perspective by looking into one of many definitions of sustainability. And we will also look into global frameworks for sustainability. And some of those frameworks can be just simply great to be aware of, but also to use, whether you are working for a larger business or if you have your own dental practice. And then we will end by exploring the topic of sustainable dentistry and a reduction through prevention approach. And I think that we can all attest to that sustainability is complex. So with that, what does sustainability really mean? And the United Nations, for example, have defined sustainability as meeting the needs of the present without compromising the ability of future generations to meet their own needs. So in other words, it's really about meeting the needs of the people that are living on the planet here today, but to live in a way that does not compromise on our children and their children's abilities to meet their needs there and then. And a great exercise to also do is to really define what is your why when it comes to sustainability. And at TP, for example, we have asked ourselves this question, and we have defined our whys by having a dialogue with several different stakeholders, from our colleagues to customers. And for us, it's really about responsibility. And we are all certainly in one way or another part of the problems, which really means that we can, in most cases, also be part of the solutions. So we want to contribute to positive development. And it's also about being relevant for people that are working here, but also being a relevant partner for our stakeholders. And then we also say that it is part of our DNA and we want it to continue to be part of our DNA. So how we do it is to live our vision, strategy, and values, include it in business decision. And another very important factor for TP is to be made in Sweden, because that really allows us to own a very important part of our value chain. Goals, measure, and follow up is also an important how. And then we view sustainability as a marathon and not a sprint. And that doesn't mean that there is no sense of urgency, but I think it's so important to really take a long-term perspective to sustainability. And when integrating sustainability into your business or into your clinic, a fantastic framework to be guided by is the 2030 Agenda for Sustainable Development. And this framework is adopted by all United Nations member states, and it's a shared framework for a more sustainable world by 2030. And it basically states where we need to go and how to get there. And at the very heart of the 2030 Agenda framework are 17 global goals that are also called Sustainable Development Goals. And the global goal number 3 that you see in the image, it is about ensuring healthy lives and promoting well-being for all at all ages. And almost all of the other 16 goals are directly related to health or will contribute to health indirectly. And defining priorities when working with the 2030 Agenda is a very important task, and TP focus on 7 out of the 17 goals. And at the same time, an action taken to positively impact one goal could, of course, actually have a negative impact on another goal. So even if you are prioritizing some goals, it is so important to really take a holistic approach to all 17 goals. And this is a great framework that can guide you and truly support your sustainability journey. And there are also tools available that can guide businesses, including clinics, for example, in how we can integrate these goals into our business and really be part of this global plan of action. And there's an endless amount of wonderful acronyms when it comes to the world of sustainability. And the concept of ESG, environmental, social, and governance, is a global key framework for sustainability. And it's not just a framework that companies can use when they report and to tick that box, but when you're working actively with an ESG framework, it's really more about taking action and making a difference. And the framework really also makes sustainability more tangible. So it's a great framework that you can use if you want to consider risks and opportunities, but also looking into the positive and negative impacts of your business. And as a dental professional, for example, simply being aware of the framework and the data that companies disclose can really support the process of analyzing the companies that you are working with. And lastly, on this slide, when it comes to climate change, specifically within the environmental pillar, there is a global standardized framework for measuring and managing greenhouse gas emissions, and that is called the Greenhouse Gas Protocol. And it's the most used standard for greenhouse gas emission accounting and management. And to just know the basics of scope 1, scope 2, and scope 3 within this protocol, or to actually do a greenhouse gas mapping per the protocol, can really support a greenhouse gas reduction journey and plan. And we all have a responsibility to act on climate change. And now that we've talked about some of the global frameworks, I want to briefly address an elephant in the room: plastic. Plastic really has its benefits and its challenges, both from a global warming perspective and also a plastic pollution perspective. And it is outstanding in terms of hygiene factors, quality, price, moldability, which supports the design and functionality, and also availability. And those are all very important aspects for our patients and customers when it comes to oral care products. There are, however, different kinds of plastic. And one thing that we are committed to at TP is to phase out materials from virgin fossil-based sources and instead source plastic with renewable or recycled materials. And I think we all daily encounter well-informed patients and customers. And for their purchasing decisions, they increasingly demand transparency. And here are some concrete parameters that they could look for when they choose a brand or a product. There's, for example, one way to look at if there is a life cycle analysis performed for the product, and what is the carbon footprint of the business. And Dr. Brett Wayne, who presented at the previous webinar that we hosted, he talked about a study regarding evidence-based healthcare with environmental sustainability using a toothbrush as a model. And it's a fantastic study on the topic that I highly recommend looking into. And one of the findings in the study suggests that toothbrushes with a replaceable brush head had a comparably low impact within all 16 environmental categories assessed. And an example of such toothbrush is the TP Choice toothbrush with a wooden handle and replaceable brush heads made with renewable mass balance materials. And of course, the parameters in this slide can also be applied to procurement in practices. Small things such as an interdental brush can truly have a positive impact. And I have borrowed this slide from my dear colleague and dentist in Germany, Dr. Rauch. And of course, everything that can be done in a practice to reduce the environmental impact counts. And this slide shows what users expect from interdental brushes from a sustainability perspective. And it can really be seen as a handprint. So besides efficiency, safety, and quality, these are some examples that are of importance for users of interdental brushes. Moving into sustainable dentistry. I've added a quote here: the primary aim of sustainable dentistry is to improve the quality of life through preventive care and quality operative care. And already 6 years ago, the World Dental Federation made a proposal for sustainability in dentistry at their anniversary meeting. And I want to highlight and encourage you, if you are a dental professional, to look into FDI's pledge for sustainable dentistry. The pledge addresses the themes that are identified in a FDI consensus statement, and TP was actually one of the founding project partners of the Sustainability in Dentistry project and actively contributed to this consensus statement. And there's also a sustainability toolkit for dental practices that you can read more about on FDI's website, which is great for general dental practitioners when you are engaging with sustainability. And I would like to wrap up sustainable dentistry with this slide that I have borrowed from my dear colleague Lina, who is part of hosting this webinar, and it shows the essence of prevention, and it's as simple as this. Preventive care can support well-being, and early detection of problems can support an improved quality of life. And prevention and high success rates does not only have a positive effect on oral health, but it can also lead to a significant economic and environmental benefit. So imagine if we educate about preventive care and inspire good oral health, that in turn can lead to reduced development of oral diseases and reduced reoccurrence of oral diseases. So increased knowledge as an effect of education can truly improve health. And when preventive care leads to healthier mouths and better general health for people, that in turn can lead to physiological well-being, social well-being, and also the absence of pain and discomfort. So improved health, as mentioned, can also be good for the planet and the wallet. Good oral health and general health has a positive impact on the environment when less resources are used, less waste is used, and not the least when emissions from travel, for example, can be decreased. With that, knowledge sharing, science, research, innovation, and education are crucial for sustainable development. And we endorse the Eklund Foundation for Odontological Research and Education. And the foundation is created to support high quality research in the field of dentistry by the Eklund family, owners of TP. And it's done in celebration of their long-standing relationship with the professional dental community. And you can read more about this and about how you can apply on the website eklundfoundation.org. I hope that you have enjoyed the webinar and that you feel motivated to take and to continue to take action towards sustainable development so that we can meet oral health care needs of today without compromising the ability to provide quality services for our future generations. Thank you.